are just coming up on 8:30 in our nation's capital. You can see the Senate still in session. If you have been keeping up over the weekend, senators have been at it for a while, working on President Trump's big, beautiful bill. And tonight, Republicans in Congress are racing against a self-imposed July 4th deadline to pass the bill.
But if they can't get Democrats on board and also keep some Republicans, they might miss that deadline.
What do I tell 663,000 people in 2 years or 3 years when President Trump breaks his promise by pushing them off of Medicaid because the funding's not there?
When Donald Trump says this bill won't cut Medicaid, he's lying. When he says this bill will grow the economy, he's lying.
Now, a final Senate vote could come tonight. If the so-called big, beautiful bill passes the Senate, it will still have to go back to the House to be passed there without changes before the president can sign it into law.
For our rural communities out there, for the farmers and ranchers who grow our food, this bill will hurt your bottom line while closing rural hospitals, closing rural grocery stores.
As you saw there, the big, beautiful bill is not sitting well at all with our state's delegation, especially when it comes to health care cuts.
As you heard some senators allude to there, this budget bill would cut around $800 billion in Medicaid funding. Our Morgan Stevens has been talking to state lawmakers and health care experts about how this is going to impact our state's rural and urban hospitals. Morgan, what did you learn?
Tessa, Trevor, the New Mexico Healthcare Association tells me that if the bill passes, it could make healthcare inaccessible to everyone in the state, no matter where you live.
The impacts on the urban locations double up on the rural, that the rural hospitals take the financial impact. No matter where you touch a spider's web, the whole thing shakes. No matter where you touch our healthcare system in our state, if we have a hospital that loses services or closes altogether, in the far northeast corner of our state, hospitals in the southwest will feel the impact.
The main issue at hand here is the cuts to Medicaid. That's the publicly funded health care program for those who are disabled or living in poverty. With $800 billion on the chopping block, it isn't only Medicaid recipients that could feel these changes, especially in our state. New Mexico has the highest Medicaid enrollment per capita in the nation at 34%. Under the bill, cuts for rural hospitals would reach almost $70 billion in the next 10 years, funding that's often used to pay their employees. The New Mexico Hospital Association says, in turn, urban hospitals will become strained as patients seek care in an already burdened system.
Those patients get transferred in to more urban locations that have those higher level of services, and that gets cut off or at least restricted down because now the urban hospitals don't have the funding to supply as much staff and as many services as they used to. So it really is a domino effect.
State lawmakers are also keeping a close eye on the cuts. New Mexico State Representative and Chair of the Legislative Finance Committee, Nathan Small, says numerous rural hospital closings is a real possibility, leading to higher premiums and longer wait times for all. The state legislature is preparing, but say in many ways their hands are tied.
Some of what we've seen proposed actually would bring even more damage to New Mexico. And we're monitoring very closely our financial situation. We're looking very closely at the timelines that are proposed in this bill, again, what I call the big betrayal bill, and trying to make sure that before those cuts hit New Mexicans the hardest, we're looking for ways to help offset that.
Again, the bill passed the House in May and is being debated in the Senate. They're expecting a final vote tonight. If passed, it will need to head back to the House before hitting President Trump's desk, which he wanted done by July 4th. Back to you.